everybody. Welcome to the Dental Diaries podcast. I am here with Dr. Jonelle Anamelechi. I had it in my head and now I knew I was going to just like cream it. All right, you pronounce your beautiful last name.
Anamelechi.
All right, welcome. She is behind, sorry for the train, behind us. Let's let that pass for a minute in case you can hear that. Children's Choice Pediatric Dentistry and Orthodontics.
Yes.
And you are so much fun.
Oh, thank you. We have a good time.
Yes, you do. Yes, you do. So to give everyone the background, so we met, so typically for these podcasts, I've met most of the people through Instagram, and I'm sure we would have met through Instagram if we had not met. So anyway, if we had not met in New Orleans, but I had the privilege of meeting her entire team and through taking photos of all you guys down in NOLA back in March before the world, like I said, closed down when we all got back, which was craziness. So was your entire team there?
My entire team was there. Believe it or not, it was our first all-team conference.
Oh my gosh.
It was crazy. I mean, we were like superstars. Like, I was like, oh my gosh, there's Jessica Emery. I know her work. Let me go meet her.
Well, my gosh, how many team members do you have? A lot.
At that time, we had 15.
Oh my gosh.
COVID changed that a lot, but at that time, we had 15.
Right. Yes. I mean, such like a big team. But let me tell you guys all, like, first of all, your personality and your spirit, and as a leader, I think, like I said, your team was all like so happy, like just shined, like definitely stood out amongst everybody when it came to, getting together. We were having, I think, was it an Instagram challenge or like, yes. What were we doing? Something. I don't know. Right. It feels like forever ago. And yet yesterday it's craziness. But so tell us, let's go back. Well, I have you here because we know you have this amazing practice now, but do you want to tell us how it all started back when, like how you got interested in dentistry and like, especially kiddos?
Yeah. Well, believe it or not, I was the kid who was pulling teeth on the playground for money. So
little Gary V dentist.
Always been the girlpreneur, now mompreneur.
Yes, I love it. Awesome.
And so hopefully those quarters have turned into dollars, have turned into, more.
Yes.
But, I had a pediatric dentist whom I loved, and she would just bring me in and show me things and show me around the office, and I really just fell in love with it. And so when I got through, the interesting part was when I got to Duke as an undergrad, I knew I wanted to go to dental school. So my approach to it was then learn how to treat people, like emotionally how to treat people. And so I majored in chemistry and cultural anthropology. I traveled across the world studying alternative medicine and had a ball, like really, really. And it just helped me kind of center myself for the type of parent conversations that I have today, about, what health means and what is healthy teeth and all those kind of things that, it kind of goes over people's heads sometimes.
Sure. So you got into, you knew you wanted pediatric dentistry prior, like going into dental school, you knew you wanted kiddos.
Pretty much, but that is like sabotage to walk into dental school like me. I'm going to be a pediatric dentist. They're like, girl, no.
Right.
So, my mentor was like, try everything.
Sure.
And I fell in love with perio and pediatric dentistry. So
okay. I love perio too. I get that.
Great. I don't know what it is, but it's awesome.
It is cool. I mean,
I found that my true passion was pediatrics, and it was where I found like I could have that initial impact, from the start. And it sounds kind of cheesy, but you do.
No.
And
it's not for everyone. You have to have a gift to be able to do what you do. Like you said, speaking to parents, to be with kids all day, every day. And you're a mom as well. So you got them at home, right? Yeah. How old are they now, your kids?
19 months.
Oh my God. So cute. I can't even. So how are you balancing mommy mode and working as a mom? Are
You
you working
know,
full time? How many days do you work?
I am. It's interesting. I worked less when I was an associate.
Of course, I know, right?
But I also think it's the fact that I have trouble sitting still.
Hmm.
So, I'm like, oh, and you know this.
Yes, I do
Like,
very well.
so practice number one, let's go to practice number two. Let's have a baby in between. Let's write a book. Let's start a new blog. How about this? So that's kind of, that's what drives the motor, but it's also what keeps me going
Yes,
because, I teach part-time and then I'm in my office, but then it feels like no day is ever the same.
yes.
And if I had every day the same, I would literally just fall out of my chair.
Yeah, I agree. I agree. I mean, I think it's good to switch so much up, but you are doing a lot of things. So tell us about your book.
Oh, so I'm not the author, I'm a co-editor. It's the parenting series called What Should Mommy Do? And the first book in the series is What Should Mommy Do for Your Child's Dental Care? And it was really interesting how this all unfolded. We met on Instagram and kind of just blossomed out of that. And it's the impact that I think the book is going to have. I'm just so excited about, when you start thinking
Awesome.
like, what is my legacy going to be?
Yes, yes.
That's where it comes from.
Love it. I mean, you do so many unique things. So let's just, you just heard, or everybody, like all of those things, but like, let's also talk about, I mean, your Instagram, you're on fire. You got like tooth cuties on duty, pump breaks. What is it? Clean and theme Saturday or something like that too. Super cute. Your taglines, and they're not just taglines, they are activities and things you are doing all of the time for your community, for your patients, the families. I mean, yeah, how do you keep all of that going
Well,
and straight? And your creative is so on point. I mean, that takes time. I know how much time all of that takes. So,
Well, thank you. It's, being a part of the community is huge for us. And so we're constantly trying to figure out how do we take dentistry out of the cold and sterile and bring it out into ways that people like can relate to.
mhm.
And I love to talk. And so relationship building is just what I want to do. I want to have relationship with schools. I want to have relationship with doulas. I want to have relationships with OBGYNs because then we form a team. Like I can literally call up someone and be like, hey, this mom's having a problem. Can you help?
Love
And
it.
it's tooth related, it had nothing to
Yeah.
do with, but there we are with those, with those partnerships. And so when we look at it, I want the team to think that way too. That how can I make impact outside of what I'm doing on my daily basis? What things do I what joy do I find coming into work? And so that's how those things brainstorm. They were like, we want to dress up, and I'm like, well, what are we gonna call it? And it's like, oh,
Today, right? Was it this morning?
I love it.
What was the title this morning?
Tooth cuties on duty.
Tooth cuties. Oh yeah, that's right. And you're all dancing around. I've got to even look at that again. That was so funny and cute and
And it
fun.
wasn't me. My hygienist brought in the little shakers, and she was like, we just need to dance this morning. I'm like, yes, we do. You are my spirit.
I love that so much. I mean, that is what it's all about at the end of the day, is like the team culture. I mean, our people, yes, but we can't take care of our people without having a tremendous team culture of love. Like people need to feel the love when they come in as well. So that's huge. I love that your team's on board. But again, that comes from you like showing up and being happy and like empowering them to give them their wings to fly and all of those things.
Well, thank you. It's been a learning process because, as you know, we aren't taught this in dental school.
Right.
So lots of discussions with you, with others in the industry of
Yes.
how does this work? How does this stick? How do we define ourselves as people? Because if we as owners aren't happy with the way we are or where
Right.
we are, it reflects on the team because they're
Mhm.
like, it looks like it sucks to come into work every day for her.
Right. Exactly. And like keeping it positive and keeping it real. Like those
Yeah.
are two big things for me because life is too short. And like we all got into this because we love what we do. So let's just play and have fun with it. Like, you know what I mean? And take care of our people and do all of the good things. And especially in dentistry, because like I'm sure kiddos, just like the adults that come in and see me, are afraid half the time. Like they seek me out as a fee for service practice and they'll pay me because like I said, they're just so scared. And I, like you, am relationship based, love my people. And to, that's why I build in the time to spend with them, to let them pour their heart out, not like next, sorry, 5 minutes, quick in, quick out, nothing like that.
It's funny you say that because my commitment to my family for my second child was actually to have a longer maternity leave. And I wasn't sure. I was like, okay, 4 weeks with the first child. I would really love more time with the second child. And my team made that happen. They were like, we'll be fine. We'll work this out. We'll get it together. We'll make sure this works. You just, focus on family. And what did I do? Buy a building and open a second practice while I was on maternity leave.
Of course you did. Oh my gosh, you did. See, you give someone like you and me too much space, we end up with a whole nother business or something. Yes. Oh my gosh, tell me about that. I mean, how did that happen?
Just things falling in place where they weren't supposed to.
Well, things always fall in where they're supposed to, but your eyes were wide open because you had downtime to see it, let it in, right?
Yeah.
Recognize it. So where is this other practice? Did you have to bring on an associate for that? Obviously, you can't be in two places, right?
So our first location is in Maryland, in New Carrollton, Maryland. Our second location is in the neighborhood I live in Washington, D.C. So that, like, I've always wanted to be a neighborhood dentist. Like, it just, for like literally kids leaving pacifiers on my doorstep because they're like, "We got pacifiers today. We just wanted to know." And I'm like, yes,
yes, I love it.
Dream. And it's just, so we got an opportunity. We talked. What does this mean for us? What does this mean for the family? And honestly, I had no idea what it meant. It meant a whole lot more hard work, honestly. But I mean, it's
in the
a place,
beginning, right?
yeah, right. But it was a place where, as we were starting homeschooling, I set up a classroom in the basement of my office, and my son, before it was flooded last week, was coming in and going to school in the bottom of my basement. Like, that's awesome for me to be able to do that, and for him to see the work that mommy's putting in,
I love it.
Be able to provide something like that for him.
Yes. Did you say they're back to school?
They are.
Oh God, heaven on earth.
Not in school, but just virtually.
But virtual. That's what my question, because there's so many here in Chicago that are actually back. Many are actually in school, but like we are still virtual, but it is, I mean, I'm just going to say it, a shit show. It is so hard. It is so hard. And my poor husband this morning, I left him to run here and I could see him like, whoo, pulling his hair out. And when he's not there on the days he can't be there, we have tutors coming just to be support to the kids. Yes. While they're watching their teachers, and their teachers have kids in the background. I mean, I don't know how kids right now, and they're learning and all of that. But to your point, I do love, like I said, that we can, whether right now it's virtual or any day really. I'm sure like your son, like my daughter, I've got 3 kiddos, but one in particular, my mini me that I show Paige on Insta a lot, always asks me, always wants to come to work and be part of it. And I think it's so good for kids to see what we're doing when we're not at home, and see how excited and how in love with it we are, and changing lives. And, our teams like love to see them and love on them too. It's so good.
It is.
So your son, is he still there then doing virtual downstairs?
So we flooded last week.
Oh no.
So we were closed for a week. Thankfully, we had another office to go to. So the whole team had some true team bonding last week because we were all on top of each other.
Wow.
And we moved his pod back to the house, back to my house. So it just keeps going.
Yeah, that's good. What I found is that with the kids, so this morning I said to Andrew, because like, again, my husband was in charge today. I had a lot on deck, and I'm like, Andrew, do you think that there might be an issue? So Morgan, my 7th grader, is literally still in like a long t-shirt with the shades down on the couch, like lying down, watching a history. Yeah, I think it was Ruth Ginsburg, something, they were doing something, but I said, Andrew, do you think there's an issue with, like, shouldn't you be at a desk, like laser beam focused, dressed, you know, and he's just like rolling. I know he's doing the best he can, and, you know, I should step in and help with that too. And then you've got to let go. This is the control freak, right? Like, let it go, let it be wherever they feel the most comfortable learning. But I'm like, I go around and I'm looking at every kid in a different place, like on a bed or whatever. And I'm like, this is not like, right? I don't know. It's crazy time right now, but that's okay. I'm sure you're hearing this from parents all day, every day too, coming in from all of them. So you're back, is your other practice not flooded anymore and you're back there too?
We're back. Both are open now, and we're back. And it's yeah, today, excitingly, we have an intern that started, and it's our I don't know, it's our second male that's ever been as a part of our team. And the interesting part about him is he's a pro wrestler.
Oh, really? Fun. That's awesome.
So he's home from college because they're all virtual, and he has to do an internship, and wants to do it with us. So we are developing this, you know, bright idea at 2 a.m. I'm like, ooh, we should do like some wrestling or team.
Yes.
And I'm like, can you go look for me like a WWE outfit?
Yes. Oh my God. I love it. I was just thinking that when you said that with him, I was like, oh, where is he on stories? Like, this has to be like vote, like, yeah, figure out, you know.
This morning we gave him a shaker, and he's like, what have I gotten myself into? And I'm like, dude, you're at Children's Choice.
You're at Children's Choice with a rock star, amazing, powerful, fun team.
My WWE uniform with the tooth on it, and we're gonna pack a punch to oral health.
Oh God, I love it. Hey, you do what you have to do, like whatever it's going to be. I mean, oh my gosh, my son showed up for school this morning with a cape on. It was going to be like, he's like feeling his Superman, you know, like whatever. Yeah. Just for fun, I think that would be amazing for them to do, or all of you to do something fun like that. So where's the other guy? Is he still on your team too?
No, we had a male on our team. He was actually one of our associates, but he's not on the team anymore. And okay. So it's an all women team. We have 3 pediatric dentists, including myself, and 1 orthodontist. And yeah, it's
that's big. That's big. Okay, so practice 1 was just how many doctors?
Practice 1, we rotate actually, because the practices are about 15 minutes apart.
Yeah.
We rotate days. So there are 2 of us in either office at one time, and then 1 of us in the other office.
But when before you dreamed up your second location, was it just you, or did you have an associate at that time too?
It was just me. So I hired my first office manager 5 years in. I don't know why I waited 5 years. Don't ask me.
Yeah.
Probably control.
Yes, it is. Let's be real, everyone. We're all women here, or maybe some men too.
Since we're being honest.
Yes, we're being honest. Let's be real.
And I hired my second associate the day before I went into labor.
Oh my God.
And my next one, a few months after I got back from maternity leave.
Okay, and that's all been great and good. Mm-hmm. I love it. I mean, I would think it would be nice, although you take on a lot more and you're getting so busy, and obviously numbers get crazy because there's so much more overhead in people. I can't even imagine actually at all what that is all about. But like, I would think it would be great, because truthfully, if you wanted to, I know you love it and it's amazing, but like if you wanted to step over to be there for your kids, to go to Europe, to dabble in other things, your practice will still run without you, streamlined. And I mean, not fall. Like, I've tried to have an associate in my practice and it just doesn't, to free me up to do all the other things I love, and it doesn't seem to work, you know? It's just, even with the systems, even with the things, and maybe it's different because it's cosmetic and it's more specialty cosmetic, and not many people have that, you know, the pool isn't as large to choose to select from, because most that have gone through all have their own practice or, or something. But gosh, I would just think there's so much light in that,
It is. I mean, for women like us, though, it's hard to fit in to the expectation. And so I've had many conversations just with myself about, okay, like what there are things that I would do because there are things that I would do.
Mm-hmm.
And I can't expect all of it, but I'll take 82% of it.
Yes. Yep. I understand that. Totally.
And you gain that trust, you gain those relationships with families that, they're like, so what do you think of that? And I get those said, what do you think about this? I was just in there. And so it's been a lot of, I've had to like step back sometimes and be like, it's okay if it's not done the way I exactly do it. It's still getting done, but the culture still has to be there. That's the one thing I've not. The quality of care and the culture has to be there.
Right. Right.
Well, you're right. It has allowed me freedom. It's actually allowed me to do some of the specialized care that I really enjoy. So like my breastfeeding initiatives, we're opening up a sleep clinic, but a lot of the breastfeeding initiatives and myself training as a lactation consultant, like it's allowed me to really pour into some of the additional specialized care for pediatric dentistry and in my practice. And it's also allowed me to be that ambassador, because I just go out and like shake hands and kiss babies sometimes.
Oh, I love it. Well,
I guess not during this time, elbow, wrist, and
I know it's so hard. You're a lover like me. I'm a touchy-feely, like love hugs and all that. And it's hard. And I can't even imagine babies, and kids. Like you want to love all over them, I'm sure. But those are two specialties in themselves that you could do full time. So within your practice to be able to do those, and oh my God, the beauty in that is like focusing on one thing like that, like tongue tie, like the breastfeeding and now sleep. I don't think I knew about the sleep. I knew about the breastfeeding, which is phenomenal, and it's not really discussed, and I think it's overlooked. Tongue ties are huge. I took Blake in way too late, my son, for that. I waited, and I could have done it. So I do laser all the time for frenums for adults when it comes to like cosmetic and relieving frenums. When they said go ahead and do it to him, I was like, oh no, not my own kid. No, there's no way. So I like looking back, but when I took him to go see somebody, I think it was the pediatric. I think I explored actually pediatric dentist here. Get this, I don't think anyone really did it. So I had to take him to the hospital, and we had to sedate, put him under. Like I remember getting a coffee and already coming back with a coffee, and he was already out. But we literally had to put him under at one, wait until he was 1, and do it then, which I hated all of that. But they didn't notice that earlier on. And with number 3, because of number 1, it was like I had a home birth. I was midwife, the beautiful thing, breastfed forever. Number 2, another natural birth, all of that, beautiful. But like slowly I was like, oh my God, I can't, like just all of the things, right, that I started taking on and trying to pump in between patients. I mean, it was crazy. And it was making me crazy. And I had the babies back to back. They're not. So when Morgan was 6 months old, I got pregnant with Paige. So they're like right back to back. And I think, I don't know if I started feeling postpartum-esque, that something else isn't talked about, but I mean, my hormones were everywhere, and I had to listen to myself and say, you cannot take on all of this. It's okay, again, control freak, to let go and move to the bottle, pump and move to the bottle, or, even bring, some, so that she would sleep better, so I could function better, some formula into the mix. By the time I got to Blake, I was like, okay, I started and I said, I am ready to let go, and realizing it's okay. They all turned out okay, but we missed the tongue tie thing. Like I somehow would have probably caught that earlier on if the whole like latching thing, probably. But like I said, it was fixed and it's good. But I think with babies, it's incredible that you can get in there actively and work with doctors, because I don't think as many look for it.
Yeah. I mean, it's been a real interesting journey, because when I start something like that, I'm like, oh, I'm not just gonna like laser it. I need to understand, the entire mechanism of breastfeeding. And people think because you're a woman who had kids that you actually understand breastfeeding. I'm like, no.
Oh, right, right. Not at all.
So like to study it and to really just know how to make a difference and make things better and counsel women, it's so awesome.
Oh my God,
So
I love it.
I get a lot more time to do some of those things, which I absolutely love. Saw two babies this morning, 2 weeks old.
Oh my God. Oh my gosh, that's so cute. And they're so little that they don't even like know the difference, like at this
No.
point. And then that helps mom and that frustration, because the thing is, the more milk they get as well, like as we know, the better they sleep and the better the mom is. I mean, it's full circle for sure. I mean, and then let's talk about sleep for kids. I mean, the whole thing with them not taking out tonsils, like Morgan finally, my daughter finally had her adenoids taken out. They didn't take her tonsils out, and she has struggled forever sleeping, kind of snoring. She's an ortho now. I'm trying to expand her. Like, she definitely has, and her face, I can like see her face profile is all up, from breathing.
Well, that story came out of a personal story with my son for 2 years, and he's only 4. And I was trying to get his pediatrician to give him a sleep study. Please, just give him a sleep study. Something's wrong. Something's not right.
Mm-hmm.
And I went to Megna Dasani's
Love her. Yes.
child conference, and there I was like diagnosing my son. I was like, yep.
Yep.
I came home that next day and I was like, I will pay out of pocket, whatever you needed. And it came to find out severe obstructive sleep apnea.
Oh
Like,
my gosh.
he did a sleep study and they called me the next day and wanted to go to surgery the next week. And I was like, you all have been putting me off for 2 years. And so did it, 30-minute surgery? Done, perfectly fine. But this was a kid where they were telling me, just wait, wait till 5, wait till 6. And you could wait all that time, but like you said, it could be ADHD, that he could not be growth. And he was already a skinny kid, like growth and development. So I got into it, I was like, parents, I'm a healthcare provider, and no one would listen to me. So I have to be an advocate for other families for this, because it made no sense for him to have to go through that when it's a simple study. It's not, it's not like they're taking any extra labs, blood, anything of that sort.
Of course, but education is everything. I mean, Megna, I know her too, rock star in this department. This is her niche and she's amazing at it. And it is her passion. And thank goodness for that, because so many kids are being diagnosed with, like you said, and being medicated for something that is not even the root cause. It could just be the sleep disorder, which is as simple, to your point, as, getting the sleep study and then, figuring out from there. But just total personality changes as well with kids.
It was a total change for him.
Oh my gosh. Well, I love that. So you're doing that too. So are you going to have, bring that into both your practices, or is just one practice going to have like a special little like suite for that? Or
I think just one practice is going to have a special clinic for that. It's really, as you try to continue to keep the level of care and excellence at a certain point, you don't want to I try not to pile on too much. And so I considering asking maybe my associate to take lead on that, so that there's, one focused person while I help get it off the ground. There are a lot of thoughts going around there. But we've already started enrolling in a pilot, and we've all taken courses. Over COVID, both of my hygienists were trained in oral myofacial therapy, so they've taken their exam. Like, it's why, everyone is just coming out of we are one powerhouse of a team right now.
On fire. You always have been, but you just continue to be. I love that.
I absolutely love it.
Oh my gosh, that's amazing. I mean, I don't know. Like I said, you amaze me, because that's a lot. And that's, like I said, a lot of people and a lot of personalities, and to all keep so happy though. I mean, that's the thing. I mean, granted, if you don't want to be like on the ship, then you need to get off the bus, right? The bus, then you can get off it. So I think you attract, just a certain, just the people, and then they all become, like I said, friends, and you're so happy and it empowers them, and it's hard to keep everyone so
I mean, we
fun.
definitely had our days. We've had our crown glory days and we've had our not so good days. And, there was a point towards the end of last year where I lost like almost half of my team, and it wasn't due to COVID. But I think I was trying to figure out myself as a mom of two.
Yeah.
I thought I was like rocking it as mom of one.
Yeah.
Mom of two took me down because time was
Right,
not,
three.
it was not there anymore.
Yes.
And I devoted so much to the team that I had to draw back and say, you all gotta fly on your own a little bit. Like I have some other things to attend to right now. And it really showed in terms of kind of who I was going to be as a leader and who the practice was going to be. And we made some transitions. We changed again. We thought we were flying. We showed up at WOW. And then 2 weeks later, COVID hit us.
Oh my gosh. I know.
We did it all over again. But
Wow.
I wouldn't take it back. I've had some good times in my families over the time we were closed.
Yeah.
And I think we've established some family habits that we didn't have prior.
It was literally such, and I know you worked entire COVID like I worked, because we saw each other. We were behind the scenes with each other in groups, and didn't stop, because when you give us time, free time that allows us to still be with our children, because like for me to be able to get up and not leave before the kids are still sleeping, and to wake up and go for a nice walk on the water by myself or a run and come back and enjoy my kiddos for breakfast and enjoy and taste my coffee, and then say, okay, mommy's going to go to work for a couple hours and be fully focused and on. What a gift. What a gift.
Happy juice. It was like happy juice. I was like, oh yeah, I could definitely do this.
Oh yeah. It was a taste like that. My happy juice was like my wine time, or my COVID-19s my husband was making at 2:00 in the afternoon. He'd be like, well, Jess, I mean, it's happy hour somewhere, right? Some of those days, I mean, you just needed it. But I loved that we all gave ourselves grace, that we just kind of stepped in. And for those of us, I know you and me included, didn't get all down. We stepped in to knowing that this was an opportunity to grow and change. And like I said, pivots are incredible, because so many great things come out of it. And those might be shifts and a practice. Like I said, I do feel like it shows true colors amongst weeds like things out, including things we don't necessarily want to do, because we had enough time to process what we want to show up to and what we don't.
I agree.
I mean, it was fantastic. I think the kids, just like I said, just having more time with our kids. I know for me personally, I was so busy and thought I was present and showing up by loving on them and the little bit of time I got with them, like in the evening. But wow, it didn't even, touch it comparatively to, the other during the COVID time, really.
I truly understand what you're talking about in terms of you thinking you're present but to really be present during that time. It's wild. We made a family COVID capsule that kind of just chronicled our time at home. So it was almost like when I went back to work, because my husband's still working from home, they were like, oh, you really have to go?
I know, my kids said that too. They said that too. And then they're like, can I go with you? And then I'm like, you got homeschool now. So like, no, you're back in school. Trying to shift the evening hours. They got used to staying up so late. I'm like, it's still a school night. I know you're home, but like, it's still a school night. Still struggling with all of that and the times. But what did you put? I love the idea of a family capsule. Like, what did y'all put? Like your happiest memories, or did you bury it?
We put some pictures. We have our kids are small, so we did handprints and
I love it.
What favorite time was, and we would just like pick something and put it in there from the day or from the time, because it's such a just interesting period in life right now. And
history.
Yeah, it's definitely, you're right. It's absolute history. And we just wanted to kind of like, I don't know when we'll pop it
Document
open.
it.
Yeah.
document it. It's funny, I look at little kids the way you probably do, I mean, because you see them all the time, but like, I definitely look at those little children and I'm thinking, wow, like when they get older, and they look back, like remembering this time we all wore masks. It's so
Yeah.
bizarro. I forget sometimes like we're even in it because I just stopped watching the news. It's just anything negative like that. And I really don't have time. We don't have time, right? For that. Like I'd rather put my time towards positive things and growth. But I kind of forget and then I step out and then all of a sudden you're just like, whoa, that's right. Like we're in this world of the masks and things. And I don't know, with no real forecast in sight either, which is really hard for, again, control people. It's like I want to schedule. Everyone's looking at their CE for 2021, and people have asked me like workshop, and I'm like, oh my god, I had to reschedule it twice. Like that second time of the reschedule, I'm like, I don't have a forecasted date, so I can't move everyone over. I'm just gonna have to wait, and I'm afraid to schedule it because I don't know. But I would love to get on the books to like that is such a fun event that I really look forward to every year. That I would love to have in the books because then it's like vision forward. It's something fun with getting everyone together. But
You
how
don't
do
know
I
how
know?
we were so disappointed to hear
I
that
know.
we had planned it as like the ultimate girls weekend. Like all
Oh
the girls.
no. Well, the thing is like I was trying to ask, and like people were falling off like crazy because they just couldn't travel, and then they're like, "Would you do it virtually?" And I knew that I couldn't do it as a virtual. And there are those of us, and again, it's so personal, right? This is also in respect, but like for me, my personality is I keep on moving. Life is still happening. I'm going to do all the things, but I'm going to keep on moving as long as I'm allowed to. But others, respectfully want to remain, or their significant others they want to respect, and having them kind of remain in that like bubble environment. So, when it came down to it, it was like, as the numbers were coming down, I was like, I don't know, like, should we just shift? Because again, like that experience is something I thrive on. And so, here we are. I know I was really bummed too. I was so bummed, but I kept the space. So I'm doing a big photo shoot in it. Yes, I have Eric coming out from California, my full team, and we're gonna use the space is like rainbows and it's so good. So I was like, let's make lemonade out of lemons, and I'm gonna be in there and feeling everybody that would have been there, and using the space because I still had it, But we do need to get another one on the books for sure. Right. And I was thinking maybe South Carolina, like closer to you, because they've got walls for days. Like I love when I was down there, I was dying because it's like the French Quarters in New Orleans. I mean, you could shoot. It's just, oh God.
Any angle is a beautiful angle.
And the wall, like I said, color pops and walls and things. The other place, oh my gosh, we were just in Denver with you probably saw. Holy moly, walls and art for days and days and days and days and days. Oh, so good. But, I love that. And I do think that type of workshop where, adds to everyone's, if people are going to do the, like people have said, I think Dawson and some of the Pankey, some of the other dental are actually doing, I've seen some people actually in seminars and things with their masks on, doing hands-on. So there are definitely people out there doing it. But that was the other thing. I'm like, if we take photos of our workshop and everyone's got masks on, like, ugh. I mean, even if they're rainbow masks, that's not going to cut it. Or smiley face masks. I know we're documenting this time in history, but
I don't want my pictures forever.
Yeah, right. We want to be able to repurpose our content.
Yes.
So we'll wait until the time is right where we can hit it hard.
I'm excited. I'll be there.
I know. I'm so excited. So excited. But I don't know. It's like one more thing to think about. Like I said, we have so many things to think about when it comes to all of the things we love, which you and I both multi-passionate people, with a lot on deck for sure. I mean, are you behind all the creative in your practice for the most part? I said, I know your team like shows up too, but you pretty much back it, right?
Yeah, I am. And these, I actually, with following you, I decided to create a social like playbook. So I put all my stuff down and kind of how to repurpose it, and so I'm looking for the person to give it off to. I enjoy it. I mean, it's tons of fun, but it takes a lot of time, as you know.
Yes.
And so I'd love to be the mastermind, but not also the micro doer.
Of course, which is why the brand like boot camp and establishing that foundation is so important for the brand, for people to understand the brand and where you're going. So we talk on the inside, like I'm trying to help people on the, to showcase the outside, because so many of us have, from what was part, the internal, we know our culture, our value, and then you've got your systems and all of the things, but somebody's got to be on deck to then showcase it and understand how to do that properly, because they're speaking your love language.
Exactly.
So, it's important, and it's been fun. Even with Members Club, I'm finding more and more. So now it's so funny because we pivot again. I'm thinking now I've got all these other ideas too, but teams, really to empower teams or a team member, because I get it. Dentists are control, like we want to take it all over. And I think it's really good that we understand it and know it and have our vision, but then we can empower a team member to take it and run. So, and like I've always said, there's always someone on the team that loves, social media that would be willing to do it.
Mm-hmm.
But yeah, people just have to do it, which you do it. So not speaking to you on this.
Someone's doing it. That's my quarter three goals.
It's amazing. You're doing a fantastic job. I love it. I love everything you are doing. Is there anything you want to share with everybody? Anything specific, unique, like anything for the people out there listening, for women in dentistry?
It's funny how our relationship has evolved. And so I continue to reach out and continue to look for ways that, like, look for commonalities in terms of helping each other. Like, I don't know how I would have made it through the COVID time without you, without some of the other wonderful people that I met. And, maybe I know before, I just heard a name of, but just in reaching out and saying, hey, I'm stuck on this. How do I do this? What do you think about this? Mm-hmm. How can we do this together? Oh, I have a tidbit of information. It may not, you may not think it's a lot, but it's a lot to someone.
Right.
So continue that share, continue that, you never know when someone needs an inspiring word, right? Totally. That quote of the day, that you just send over, that meme that you feel like, this is hilarious. Yes. You never know. And so just continue to do so and not squirrel away. Continue to be out there so that whenever your time comes for need or whenever someone needs you, that you can be there and support. Because this year alone, in terms of that, has been tremendous. So it's been really awesome, and I thank you for being a part of that, Jessica.
Thank you so much too. It's been, again, tremendous finding. I agree with you, and that's the power of social media and why I stand behind it too, because I have met so many incredible people and built relationships all over the world, really, with women doing amazing things. And we're also isolated, many of us in private practice, where you have the bigger team and associates. There are many of us in, smaller isolated practices too. So I think community over competition all day, every day, and, leaning into that and being there for others, if needed, and find your tribe, like
community over competition. I like that.
Yes. And like, it is a tribe at the end of the day, and there's enough people doing things between Facebook and whatever, and you just have to find where you feel like you fit, and, and go from there. But it's been fun, and I so appreciate you being here. How can people find you? Can you just give a shout out to your handle and your website?
Absolutely. You can find me on @Children's Choice Dental, or Mom Inspired Dentist Approved. And we are www.mychildrenschoicedental.com. mychildrenschoicedental.com.
Woohoo! Awesome. Well, I thank you so, so much for being here today with us. And I know you have to get back to work. So thank you for your time today. So appreciate it. I appreciate you and all that you're doing. And I know I'll be seeing you soon. So everyone else, just head over and check out all the incredible at her Instagram handle, Children's Choice Pediatric Dentistry. And yeah, you can see what she's doing. All right, until next time, guys. Thank you.